Yeah, for many years I've been interested in next generation sequencing to determine the mutations, obviously a diagnosis to be able to risk stratify patients with acute myeloid leukemia. And more recently, we have been using next generation sequencing to determine residual disease, as I just indicated already. And well, some years back, we have shown that some mutations do, and when persisting in complete remission, do have an impact on relapse rates, whereas other mutations do not. And we, in the past years, we have been trying to optimize these analyses, so to reach higher sensitivities and specificities for the mutations in complete remission. And we have been successful. We are still working on this, so really to incorporate error-corrected sequencing in our analysis. Lately, we have been looking at FLT3 ITD mutations. So those are the internal tandem duplications in the FLT3 gene, which are now also really nicely detectable with next-generation sequencing, which was not possible previously because these mutations are of variable length and the location is also variable, which made it, in the past at least, quite difficult to determine these mutations for each and every patient. These analyses typically required patient-specific assays. Well, now with next-generation sequencing, we can determine them quite nicely for every patient with an FLT3 ITD. We can sequence at high depth and also high sensitivity. And what we show is that if you study patients with FLT3 ITD AML, and you are still able to detect these FLT3 ITDs in complete remission, these patients have a really high, up to 80% chance to get a relapse. So this data is obviously of value. This is done on retrospective samples, so patients that only received high-dose chemotherapy, so without FLT3 inhibitors. And I think it will be of great interest to apply these kind of analysis also in the current studies in which we study the FLT3 ITD or the FLT3 inhibitors in general.